What causes heartburn? Just between your chest and abdomen is where you find one of the most important muscles you probably didn't know you had, the lower esophageal sphincter or LES. When functioning properly, this ring of tissue plays a crucial role in helping us eat. But when the LES malfunctions, it becomes the main player in heartburn, a searing, sometimes sour-tasting chest pain that many people will experience at some point in their lives. We know that humans have been battling heartburn for hundreds, if not thousands of years. But recently, the incidence has risen, making a common stomach complaint a while. When the symptoms of heartburn become more regular and intense, such as twice a week or more, it's diagnosed as gastroesophageal reflux disease, or GERD. But what causes this problem and how can it be stopped? Heartburn starts in an area called the gastroesophageal junction, where the LES reside. This smooth muscular ring of the LES is moderated by an interpurgatory of nerve roots that connect the brain, the heart, and the lungs. After food enters the stomach from the esophagus, the muscle's task is to stop it from surging back up to again. The LES contracts, squeezing the stomach entrance and creating high-pressure zone that prevents gastric acids from seeping up. But if the LES relaxes at the wrong moment or gradually weakens, the effects like a faulty, ill-fitting leak, causing the area of depressurized. That allows burning stomach access and even chunks of food spurt into the esophagus, sometimes going as far as the mouth. The cause of all this entire drama has long as been put down to diet. Food like caffeine and peppermint contain ingredients that may have a reflexive effects on the LES, which makes it incapable of doing its job. Other foods like citrus and tomatoes can worsen irritation of this esophagus when it leads out with the smoking acid. Carbonated beverages can similarly bubbles in the stomach, forcing open the valve. But researchers have discovered that food isn't the only trigger. Smoking poses risk because the nicotine in cigarette relaxes the LES. Consuming excess amount of alcohol may have a similar effect. Pregnant women have experienced more heartburn due to the pressure of the growing baby on their stomach and the level of certain hormone in their bodies. Obesity can cause the hernias that disrupt the anti-reflux barrier of the gastroesophageal junction that normally protects against the heartburn. Numerous medications, including those for asthma, high blood pressure, birth control, and depression, can also have unintended effect on the LES. An occasional bout of heartburn isn't necessarily something to worry about, but if heartburn starts happening regularly, it can weaken the LES muscle over time, letting more and more excess escape. And if it goes on treated, this can cause bigger problems. Over time, constant acid leakage for heartburn may form scar tissues which narrows the esophagus tube, making it harder to swallow food. Ongoing reflux can also damage the cells lining esophagus, a rare condition called Barrett's esophagus, which can elevate the risk of esophageal cancer. Luckily, heartburn is often treatable with a range of medicine that can help neutralize or reduce stomach acid. In extreme cases, some people have surgery to tighten the LES to minimize their distress. But we can often stop heartburn before it reaches that point. Reducing the consumption of certain food, not smoking, and maintaining healthy weight can all dramatically reduce reflux. With proper care, we can help us LES keep the chemical foundation of stomach in proper order and avoid having to feel the burn. This is the another video. What happens if heart arrest happened. Approximately 7 million people around the world die from heart attacks every year, and cardiovascular disease, which causes the heart attack and other problems like stroke, is the world's leading killer. So what causes a heart attack? Like all muscles, the heart needs oxygen, and during a heart attack, it can't get enough. Fatty deposits or plaques develop on the wall or coronary arteries. Those are the vessels that supply the oxygenated blood to the heart. These plaques grow as we age, sometimes getting chunky, hardened, or flattened. Eventually, the pressure can grow into the blockage. If one of the plaques ruptures or cracks, a blood clot will form around it in minutes, and partially closed artery can become completely blocked. Blood flow is cut off to the cardiac muscle, and the oxygen-starved cells start to die within several minutes. This is a myocardial infarction or heart attack. Things can rapidly deteriorate in the absence of treatment. The injured muscle may not be able to pump blood as well, and its rhythm might be thrown off. In the worst-case scenario, the heart attack can cause a sudden death. And how do you know that someone having a heart attack? The most common symptom is the chest pain caused by the oxygen-deprived heart muscle. Patients describe it as crushing or vice-like. It can radiate to the left arm, jaw, back, or abdomen, but it's not always as sudden and dramatic as it is in the movies. Some people experience nausea or shortness of breath. Symptoms may be less prominent in women and elderly. For them, weakness and tiredness may be the main signal. And surprisingly, in many people, especially those with diabetes, which affect the nerve that carry pain, a heart attack may be silent. If you think that someone might be having a heart attack, the most important thing is to respond quickly. If you have access to emergency medical services, call them. They are the best way to get to hospital. Taking aspirin, which thins the blood, and nitroglycerin, which opens up the artery, can help keep the heart attack from getting worse. In the emergency room, doctors can diagnose a heart attack. It commonly uses an electrocardiogram to measure the heart electrical activity and a blood test to assess heart muscle damage. The patient is then taken to the high-tech cardiac suite, where tests are done to locate the blockages. Cardiologists can reopen the blocked artery by inflating it with a balloon and a procedure called angioplasty. Frequently, they also insert a metal or a polymer stent that will hold the artery open. More extensive blockages might require coronary artery passage surgery using a piece of vein or artery from other part of the body. Heart surgeon can reroute blood flow around the blockage. This procedure resupplies circulation to the cardiac muscle, which is during heart function. Heart attack treatment is advancing, but prevention is vital. Genetic and lifestyle factors both affect your risk, and good news is that you can change your lifestyle. Exercise, a healthy diet, and weight loss all lower the risk of heart attacks, whether you have them before or not. Doctors recommend exercising a few times a week, doing both aerobic activity and strength training. A heart-healthy diet is low in sugar and saturated fat, which are both linked to heart disease. So what should we do? Lots of fiber from vegetables, chicken and fish instead of red meat, whole grain, and nuts like the walnuts and almonds all seems to be beneficial. A good diet and exercise plan can also keep your weight in a healthy range, which will lower your heart attack risk as well. And of course, medication can also help prevent heart attacks. Doctors have prescribed low-dose aspirin, for example, particularly for patients who've already had a heart attack and for those who may be in a high risk. And drugs help manage risk factors like high blood pressure, cholesterol, and diabetes, will make the heart attack less likely too. Heart attacks may be common, but they don't have to be inevitable. A healthy diet, avoiding bad use, staying fit, and enjoying plenty of sleep and lots of laughter all go a long way in making sure your body's most important muscle keeps on beating.